What is used in the treatment of outpatients, that is patients at home. Calamine lotion, mixture of magnesium oxide and zinc is a shake lotion that some of you might remember, prescribed by older dermatologists. It has a whitish appearance. By evaporating from the skin, it cools it slightly and provides an anti-itch effect. Kuchik's gel is also used. This is another plant-based remedy that provides the same local cooling effect. And there's also the pox cleaner hydrogel. Sometimes antihistamines are used, but again, it all depends on how prominent exactly is your child's tooth. There is also a method involving the use of human immunoglobulin, normal. It's not always justified. In some cases, its use is debated, but the method remains, and for now, it is still available. In severe cases, of course, the following is used. As a direct etiological treatment for herpetic infections, remember that the disease is caused by herpes viridae, and the antiherpetic drug is acyclovir. It is also used in pregnant women with chickenpox. Antipyretics and antibiotics are used. Again, according to indications. Regarding bathing children is possible, but you should carefully consult your pediatrician about this. Why consult a pediatrician? They can assess the nature of the child's rash. Is there an inflammatory process in these rashes? If there is no pronounced inflammation and you see that the illness is still quite mild, it does not require any specific prescriptions. On acyclovir, the child behaves quite calmly and is fairly active. It is indeed possible to bathe them in a tub bath are preferable, because the shower stream, it really can injure these scabs. It is possible that this could later lead to secondary infection. The water temperature for bathing a child should be up to 36 degrees, and the bath should last no more than 5 minutes. You can use chamomile decoction or oak bark as antiseptic and drying agents. This is quite acceptable. But the kind of bathing we are used to seeing with hot or fairly warm water, using drying soaps and shampoos. Under no circumstances should this be used during the period of rash. It is indeed possible to give a bath, but afterwards, do not rub the child absolutely, no rubbing, but rather gently dry the child's skin. You can use napkins or simply pat the skin gently. This is very important, to not injure the skin or damage the blisters. When the blisters are gone, when the scabs are fallen off, or when we see the stage of the illness where there are no new eruptions, no new vesicles are appearing, and the scabs are starting to regress, they are falling off, or perhaps there are other symptoms, but the child is feeling relatively well, and you realize that the child really needs just to have a bath. Yes, at this point you can bathe them normally. You can use shampoo, soap, and hygiene products for bathing your child as you are used to. It is very important to remember at this stage that the scalp should not be washed when there are still vesicles on it. The child's scalp, the hairy part of the head, should simply be rinsed with water. Under no circumstances should you use a shower and never use shampoo or soap to treat the child's scalp. Usually, after 2 to 3 weeks, you can already have a full bath knot, just what we talked about before. Why after 2 to 3 weeks? Because by then these scabs have dried up and the illness is regressing, so there really is an opportunity for a proper bath for the child, and you can gently use a washcloth, of course. And you can also use a gentle wiping of the child to help dry them off. As for whether it is possible to get sick again and how the illness manifests itself if it recurs, at the moment we believe that it is not possible to get sick again. Specifically regarding chickenpox, we have already discussed the situation with shingles. Shingles is, in fact, a recurrential repeated manifestation of chickenpox. This 30% are exactly the manifestation of chickenpox. At the moment when you diagnose yourself with chickenpox again, you should start asking yourself some questions. A doctor will always ask this question for one simple reason, to avoid unnecessary confusion. The question of whether it was actually chickenpox back then, or if it isn't chickenpox now, is also very important to understand. This also includes people who, for example, suffer from shingle-shops zoster, since it's caused by the same pathogen. Now, regarding children who have had chickenpox, usually there is a 1 month interval before they can receive preventive vaccinations.